Hey everybody, it's Johnny Bowden. Today I'm going to answer a question from the YouTube community, and the question was, what is a coronary calcium scan? Do I need it? Should I worry about it? What does it do? And I'm going to give you the short answer and a little bit longer, more interesting answer in a moment. But the short answer is a coronary calcium scan is a picture of your arteries. They use all kinds of, complicated tomography or x-ray technology, but the point is they look inside the arteries and they look to see how much calcium, if any, has been deposited. The location of those deposits, the density of those deposits. And why do they care about that? Because when you think about what hardening of the arteries is, atherosclerosis, which literally means hardening of the arteries, a lot of that comes from calcification. Right? Even our language, when we use the word, it's very calcified. We mean it's hardened. It's set in stone. It's hard to move. It's hard to change. So we don't want that. We don't want calcium winding up in the arteries. We want calcium winding up in the teeth and the bones and the skeletal system. That's where it belongs. When it goes to the arteries, we're in trouble. And there are things you can do to prevent calcium from going into the arteries. I talk about that in another video on vitamin K2. But for now, all you really need to know is that a calcium coronary scan looks at calcium in the arteries. And that's a very, very important predictor of events such as heart attacks. Okay? Now, the longer and more interesting thing about this is that for years, we've been using the good and bad cholesterol test to predict what's going to happen in the arteries. I mean, the good and bad cholesterol test, as it turns out, is a horrible predictor. And I've made a big part of my career the mission of getting rid of that test once and for all, because we have so many better ways to look at what's going on with the heart than the good and bad cholesterol test. And the person that I think is someone, if you're interested in this, that you want to check out is a guy named Ivor Cummins. His name is Ivor Cummins, and he's got a zillion videos on YouTube. And here's why I think you should pay attention to him. Ivor Cummings is actually, I'm not sure if it's pronounced Ivor or Ivor, but he's actually an Irish systems engineer. These are very smart dudes, man. If you've known any engineers, I happen to play tennis with a bunch of them. They're another breed. They're just very smart. And the way they analyze problems is very different than the way you and I do. They just look at the entire system. And Ivor Cummins actually leads teams of these systems engineers to go around to some of the most complex companies in the world, analyze their systems, their communication, their IT, their infrastructure, figure out what's going wrong, where the bugs are. And they're just very good at that. So Ivor Cummins goes to the doctor and he gets himself a diagnosis that he doesn't understand. His cholesterol is elevated, his triglycerides, there's a whole bunch of other stuff. They're telling him you're on the path to a heart attack. He wants to know more. He wants to understand why. He doesn't just take this information from the doctor. He wants to figure it out. So he applies a systems engineer point of view to the whole cholesterol thing. And this is why he's become kind of a hero in my circles and in the anti-cholesterol test circles of functional medicine and functional nutrition. He looks at the whole system and he says, this doesn't make sense. Cholesterol doesn't do what you're saying. It doesn't even really predict heart disease very well. And he starts looking at it this way, and that's why he became a passionate advocate for the coronary calcium scan, because he said, why are we using a bad predictor to figure out what's happening when we could be using an x-ray into the thing we're trying to predict? So it's like the difference between when you poll voters before the election and you try to make a prediction of which way the election is going to go, or you look at the vote count after the election has happened. Which would you rather know? You'd rather know what you're actually trying to predict, right? And that's why a coronary calcium scan is so important. So, mostly this will not affect anybody under 40 because your doctor's not sending you for either a calcium scan or probably putting you on a statin drug, which is what they do when your cholesterol is high. But if you're over 40 and your doctor's even talking to you about cholesterol tests and he's even thinking about putting you on a statin drug, for God's sake, ask for the coronary calcium scan first, because that is going to tell you what's really going on with your heart. And this is Johnny Bowden. I hope you liked this explanation. Please hit the like button if you did, and please subscribe to the channel. We love to see those numbers go up. And send those questions in. I love answering them, and I will continue to take them from the YouTube community. So, Happy New Year, and I will see you in the next video.